Let's talk about seasonal allergy relief. And a couple of my patients, one is a 42-year-old man, and we did the same for his 6-year-old son. So this is somebody that came in to see me not because he had neck and back pain, but because he had seasonal allergies. His wife was a patient and said, go see Dr. Fuller. So he came in with bad springtime allergies for his entire life at age 42. And it always happens in late April through late May. What I did on the first visit is I advised a gluten-free and dairy-free diet. And he said, so his symptoms were severe enough where he said, I'm going to do this. And he did it. So I saw him about 2 weeks later. And he said, allergies are much better overall, and I am 100% off gluten and 100% off dairy. He would need Claritin every day, the medication, during that period of time. And he said, no Claritin needed for the past 10 days. So it only took a few days in his case to see some marked improvement by just removing gluten and dairy. I then saw him later that year in September. He comes back in and he said, I'm still gluten and dairy free and huge improvements in allergies. So he had other symptoms during the year, not just in springtime, but springtime would really wipe him out. Sure enough, I saw him a year later coming into his next allergy season, and he said, I have stayed gluten-free and dairy-free, and I'm actually doing really well. Simple solution, right? Okay, so they were impressed with their improvements, mom and dad, so they sent in their 6-year-old boy. He has seasonal allergies for the past 2 years, so ages 4 to 6. During the month of May, sounds familiar, like dad. And right now he's very bad when he was brought to see me in May, with runny nose and itchy eyes, okay? So I discussed, in his case, just a no dairy diet. I just said, let's get off the dairy first and see how that works. I see him a week later, and the son seems better. He's off his allergy relief medication. His eyes are not glued shut in the morning, said mom, like they usually are. And the no dairy products is actually going well. So they didn't find that much of a problem. Sure enough, I saw him again a year later running into the next allergy season. His dad brings him in, and his allergies are significantly reduced with a reduced dairy-free diet. They were not totally dairy-free, but he's doing a ton better. So there is a great solution. I have talked about allergies and seasonal allergies, asthma, eczema, and psoriasis on this show before. I have copies of those on my YouTube page if you want to go catch those, where I talk more in detail. For some people, eliminating dairy or eliminating dairy and gluten will not solve their allergies and asthma. Sometimes we have to dig a little bit further. We have to do food sensitivity testing, chiropractic care, and so on. So you can go check those shows out. But here's some nice solutions for these folks. I'm Dr. Scott Fuller. Please join me again.